Welcome everybody to the podcast Empowered Voices, Recovery to Resiliency. I'm your host, Dr. Farzad Kamyar, joined by...
And I'm your host, Amani Wilson. Super excited. This podcast is going to be about just the journey for families and people in recovery, their challenges and their triumphs through recovery. I'm super excited about all the upcoming episodes that we have launching. I'm also excited about our guest. What are you most excited about, Dr. Farzad?
Holy moly, a lot of things, right? First, I guess an honor and a privilege to be working with you, Amani. Thanks so much for doing this.
Thank you for
I am
having me.
so looking forward to having folks listen to your journey because it's probably very representative of a lot of journey that folks have had to take, right, with substance use disorder or need to take, right, or will be taking.
That is true.
Or have not taken yet. How about that?
Yes, love it.
Why are we doing this? Amani, you did a great job of sort of talking about what are we going to be discussing, right? Let's call it substance use, getting from recovery to resiliency, which is massive, right?
It
Sounds
is.
easy on paper. It's 3 words, recovery
Looks
to
easy.
resiliency. But oh boy, recovery is massive, resiliency is massive, and everything in between is
Yes.
massive. But at the end of this, why are we doing it? I'm going to share a couple stats, I guess.
Please.
So, I'm a physician, so I sort of, AKA, will represent the medical, right? The medical community,
Yes.
the healthcare system. In the U.S., if you look back at 2020 numbers, which are sort of the most recent that we have, right? Causes of death here in the United States, and for what we call the reproductive age population, which
Yes.
formally is 15 to 44. However, the same thing extends down to 10 and up to 50.
Wow.
After 50, you start to get things like cancer, heart attacks, that unfortunately become the leading causes of death. But for that 10 to 15 age range, by far, and not even close, you can take the next 2, 3, 4, 5, whatever it is, add them all together, and they still don't add up to this. Number 1 cause of death, Mani, is overdose.
Yes.
What we call unintentional poisoning.
Yes.
Okay. So we're dealing with something that is right now killing people by, normally I would say something by the boatload, but in this case, more representative would be kind of like by the plane load. Effectively, when you look at a couple hundred people who are dying every single day from overdose, it's like one of these traveling planes crashing into the ground
is.
every single day. So ultimately, I hope that folks come away with some information that might get them onto the path to recovery and really save a life.
Yes.
Save a life.
And eventually into resiliency.
Yeah. And then get
That's
to
the
live a
best.
life, right? And then get to live a life.
Amen.
Yes,
Save a life
absolutely.
so they can live a life.
And like you mentioned, we're going to have various topics that cover the sort of things like harm reduction, getting into care coordination, what is peer recovery support. Those are some guest speakers that we're going to be having. And then I sort of mentioned this in a little bit later, but I hope to bring to the table some of that physician knowledge, right? That expert medical knowledge to the table. Whereas I'm hoping that you can bring all that as well, because I know you have it, right?
You've been the doctor in front of my name.
But some of that patient side, right?
Yes.
I'm looking for you to represent the community and all those that are affected by.
And that's what I'm here to do. I'm here to help by any means possible, just not quite expose, but really shine light onto what people who are suffering with substance use disorder are truly going through and how we can possibly help that person as well as their family members, because family members suffer just as much as that person who's going through that substance use disorder.
Thank you for bringing that up. Okay, I'm just going to give you a little bit about why I chose to go into the field of mental health, including substance use or addiction medicine. When I was in medical school, I had no idea what I wanted to be. Right? What specialty was I going to go into? And then you start to get into things like chronic diseases. For example, diabetes, high blood pressure.
Yes.
Super common in the U.S., right? And throughout the world, but
Yes.
super common in the U.S. Well, you start to look at sort of the impact. Now, if I'm someone who is, let's say, 65 years old and I have high blood pressure, oftentimes it can be very isolated to me, the effects of. Right? So I'm the one that might feel crummy, have decreased energy, unable to climb stairs, et cetera, right? But my family generally is sort of, let's say, less affected.
That
my
is so
friends
true.
are less effective.
So true.
Let's flip the script. Mental health and substance use.
Yes.
If I am active with a substance use disorder, I promise you that it's not just me that's being affected.
Oh, yes. I can tell
Right.
you from experience.
Yeah. So that's what drew me to the field. I knew that like the impact that I had on this person's life was going to be more far reaching than just that individual themselves. And we see this all the time. And that's why some of the goals that we have are to basically empower families and communities
Yes.
because we are all affected.
Yes.
Right? We are all affected by this.
Yes, you are so right. And that's probably why you're so amazing at what you do. Because, no, honestly, because you really need someone to actually really care about that person to really do a great job at serving them, really helping them with all the services, the resources that they need. They need someone to care. And just for you saying, not just helping that person, but helping others, because when you do help that one person, you're helping somebody's mother, somebody's dad, somebody's grandma, even. I mean, cousin, sister. I know my sister was elated when I, was abstinent from using drugs. So you really do touch so many lives just by helping one.
Yeah, it's a huge issue. We've seen numbers increase. I'll get a little, back into numbers.
Let's
per
do
se.
it.
I brought up things like chronic issues like diabetes. Big thing in our country, right? And we actually do a really good job, I think, at identifying diabetes when you go into your primary care clinician's office and you're
Yes.
like, I'm Amani Wilson, and I'm here to see you for the first time. My guess is as part of your evaluation, they're going to put a blood pressure cuff on you because they're
Yes.
screening for hypertension, right? They're going to do some labs, and that's looking for things like diabetes or prediabetes. They're screening. But the question becomes, what are we doing for mental health and substance use, right? My guess is maybe nothing, maybe very little. But to put this into perspective, we talked about the number one cause of death for 10-year-olds up to 50-year-olds,
Yes.
right? Well, let's look at overall numbers, right? So going back to 2022, about 37, 38, 39, somewhere in that high 30 range, the number of folks that have diabetes in the United States. Amani, how many people do you think have a substance use disorder?
So many. I really couldn't even put a number on it, honestly.
And it's sort of, I would say it's counterintuitive, but we think of this as being a smaller issue. Wait, hold on. So we hear a lot of talk about diabetes. We do a really good job at screening for it. My gosh, most recently in the news, we have all these new medications that are coming out. Can't even find them in the pharmacies.
Cannot.
Right? Well, sum total, 37, 38, 39 million folks in the United States that have diabetes. The most recent for substance use disorder is 48 million.
Wow. That's a mic drop.
A significant proportion of our population has, and that's only a substance use disorder. I'm not including other things like depression, anxiety, PTSD, etc.
Exactly.
So it's time to uncover all this stuff. It's time to focus because it's not a joke. It's not this sort of irrelevant little, that's people who aren't good people. They've got a moral sort of weakness or deficiency. Why can't they just stop? Why don't they just exercise willpower?
You are so right, Dr. Farzad. And I love how you said about substance use and mental health, because a lot of people it's kind of like what came first, the chicken or the egg. A lot of people suffer with mental health and try to self-medicate by using substances. And some people have substance use disorder and then eventually end up with the mental health issues due to the substances. But it's truly a catch-22. And that's why, like you said, when was the last time you've had you mentioned about doing a screening for the hypertension, but when was the last time you've done a screening for mental health, unless I've actually scheduled an appointment to go see a psychiatrist?
Yeah. So along those lines, we talk about empowered voices. Another one of my goals would be to empower folks to advocate for themselves.
Amen. Yes.
We might not do the best when it comes to listening. We meaning the sort of healthcare, okay? We might not do the best when it comes to following recommended best practices. What should we be doing? Let's just assume that we're not going to, okay? For the purposes of this podcast and our talks. Let's
Sounds
assume
good.
we're not going to. So I would love if our listeners and viewers could be empowered to have the information, the knowledge, know the resources and tools to then advocate for themselves,
Yes.
to say, I just came to your office. I just found out I'm pregnant. Go. You do all the stuff that you are going to do for me to be a new patient.
Yes.
And if that doesn't include substance use screening, if it doesn't include questions about mental health, I'm going to be empowered to ask them myself. Hey, you didn't ask me about this. I'm suffering from symptoms of depression. I'm suffering from symptoms of anxiety. Relevant to the Empowered program in this podcast, I am using XYZ. What are your thoughts on that? Let's have a conversation. Sort of reducing that stigma, right?
Yes.
I just told a new, let's say, a new mom who's now pregnant to walk into a medical clinician's office and let them know that they're using substances. Oh boy.
And demand that they treat them.
Yeah, right. So a huge paradigm shift.
Yes.
We will be talking about topics such as Child Protective Services and Department of Family Services because through and through, I'll tell you this, Amani, for patients that we have who are pregnant and using substances, there are two fears and they're tied.
I was just gonna say those are two scary terms you mentioned.
Why don't you tell me from your experience? What were your biggest fears?
Well, my biggest fear, especially with CPS, is you're just always scared that, wow, you're using or, wow, they're going to take my child. There's no hope. They're going to find out that, that you're using substances and your child's going to be gone with no hope of seeing them again. So that's the biggest, scariest thing when you're dealing with CPS is nobody wants their child to be taken. But we do need help.
Yeah.
That's
Yeah, absolutely.
and these children need a safe place to be as well. So it's always a catch-22. It seems like CPS is so horrible. They do have a job to do, but it is a big stigma, especially dealing with that.
It is huge, and you hit the nail on the head. Our patients' top two fears equal in
Yes.
severity. One, what's going to happen to my baby? Is CPS going to remove baby?
Yes.
Right. Number two is, what am I doing to my baby?
Yes.
Is my baby going to be okay?
Yes.
Because I'm using substances.
Yes.
So let's put that as additional goals, hopefully providing some insight into those. The quick on it is your baby will hopefully be okay. If you get treatment, your baby will be okay.
I was just thinking that. Yes, and your
Yes.
baby will be okay once you
Yeah.
get treatment.
Yes, absolutely. And, in working closely, right? We work closely with the Department of Family Services. I will tell you, their goal, number one, is unification.
It is.
It is actually not separation. They do not want to separate kiddos from their families.
And you are so right. It is.
Yeah. And despite the fear that we have, I fully understand absolutely that is the fear. Hopefully we can do a better job at getting some of that education out there.
And that would be definitely a topic to put a pin in because, yes,
Pin.
that
A
is
really big nail.
Yeah, how
really
about
big
that?
nail.
Hammer it too, because it is so true. That is one stigma. Dealing with substance use disorder and being a mother and having children is CPS. It's just one of those things, but I can't wait to hear how we can advocate for ourselves, how we can navigate through if we are faced with a CPS, how we can get help and navigate and do the things that, like you said, they want to reunify you with your child. They don't want to really there's honestly, like you said, there's not enough homes to place these children. So they really do not want to take your child.
Yeah.
And we just have to push this information so mothers can get help or fathers can get help and we can be reunified as a family again.
Yeah. And all the paths that we've talked about, you talked about unification, you talked about paths to getting treatment can be different for everybody.
Yes.
Right? Different for everybody. And we sort of see the variation. Let me give you an example. of how folks arrive into whatever their path to recovery and resiliency is. I'm going to go back to diabetes. Amani, you're going to hear me do this all the time.
It's okay. I'll never get tired.
Fundamentally, in the world of medicine, we think of substance use disorder and addiction as just another chronic disease. So I view it exactly the same as diabetes. The same sort of mechanisms. There's changes that happen into your body, and there's results, right?
Yes,
due to
you're
that change.
correct.
And we have treatments. And there's various forms of treatments. And some treatment works for some, and some treatments work for others.
You
and
are
it doesn't
right.
look the same. However, what's a little bit of a difference? Stigma is huge. Discrimination is huge. Marginalization is huge.
It is.
Being thought of as a criminal is huge. Getting back to that sort of the story on how people can enter treatment. Very rarely do we find that someone's path into treatment starts with the criminal justice system when it comes to diabetes, right?
You're right.
Oftentimes, we're catching it much earlier, right? It's not a problem to talk to it about your healthcare provider or your healthcare
It's not.
professional. It's not a problem to talk to it about this person, person A, person B, person C. But when it comes to substance use, so we find that criminal justice, even though it has sort of these bad negative connotations associated with it, can actually be a very positive place in regards to getting folks into treatments.
You know what? You are 1,000% correct. Some places, and unfortunately, it's tough to say, but sometimes some people need to have a seat and have a sit down, get their minds right, so that we can actually start working towards recovery and then to resiliency, because that's the path we want to go.
Yeah.
You are 1,000% correct.
Yeah.
You know what? I heard someone spoke to me and told me that, and I would love for you to elaborate on I noticed you referenced diabetes a lot, and they had mentioned that with diabetes, it's okay that you have diabetes. It's not okay that you have diabetes, but it's not stigmatized as a substance use disorder. And yeah, if you have diabetes, usually you have to restrict yourself to a certain type of dietary needs and whatnot. And usually nobody's really hounding somebody for eating a piece of cake when they're not supposed to. But if you're using or you're a substance use disorder, of course we don't want you to, but it's very much more stigmatized that, oh, wow, when they're both medical issues. Am I right or am I wrong?
You are 2,000% right.
There we go.
We, with Roseman University, we do a lot of education, whether that's attending conferences and giving lectures or speeches or whatnot. But this is a huge topic, which is addressing the stigma of just how the disorders are viewed, not just from a patient's perspective, but from a clinician's perspective,
Yes.
from government agencies' perspective.
Yes.
The list goes on and on and on. I can give you 40 different examples right now of how things are viewed differently. Just a couple of them. You mentioned, if I'm able to live the life that I want to live and be active in my sobriety, active in my recovery, taking a medication for a substance use disorder,
Yes.
that is amazing, and that is life-saving. I mean, it's literally life-saving. We talked about that, right?
Yes.
And if I'm doing the same thing for my diabetes treatment, same thing. It is life-saving.
It
right?
is.
Now, with substance use, I might overdose tomorrow, right? So
is.
it's right here, right now, and down the line. With something like diabetes, hopefully it's more down the line versus right here, right now, okay? But when family views those treatments, we've had plenty of folks. My family doesn't know I'm taking the medication. I can't let anyone know I'm taking the medication. My parole officer can't know I'm taking the medication. Department of Family Services can't know I'm taking a medication. My employer can't know I'm taking a medication. The list goes on and on. And this is just medication we're talking about.
To help them in recovery,
That's
to
right.
resiliency.
Do you get the same thing for diabetes?
Not at all.
Not at all.
Not at
Family's not telling a diabetic, hey, have you ever thought about getting off that insulin? You've been on it for 3 months. Isn't it time that you get off of it about now?
Exactly.
Right. And that happens all the time.
All the time.
For substance use treatment.
Yes, and I loved how you placed that because it really just puts it into light how stigmatized substance use disorder is. And it's not, honestly, I can say it's not something somebody chooses to do. They're just like, oh, I'm just going to find a substance and get at it. It's usually something that comes through in hard time, hardship, something that was introduced to them maybe in a hardship or as a fun time that turned into a hardship, because usually any type of substance use is going to lead to hardships. And that's the biggest.
Yeah, great example. Again, my gosh, we're going to say the term stigma so much.
You're going to get
viewers
sick.
and listeners, please do not get sick of it.
They'll be sleeping.
One of my requests, but it's just because it's so prevalent within the field of mental health and substance use. But along those lines, when you were talking about the stigma associated with what did you just mention?
I mentioned quite a few things.
I know, but most recently, the stigma that is associated with
substance use disorder?
Yes. Okay. When we talk about sort of treatment as a whole, one of the things that you had mentioned was even those that are entering treatment. I can't think of another specialty in medicine where the folks that are going to seek treatment for that specialty get discrimination, get stigma from the specialty themselves.
No.
That to me is really
mind-blowing.
devastating. Yeah, that to me is really devastating.
It is. I've unfortunately experienced that.
Yeah,
You're like, didn't
you
you go to school? You have to do schooling to actually be in that profession. So you're like, you really went to school for all this time. You spent money to get your degree to really treat somebody who's really seeking your expertise and your services, to really treat them like that.
Yeah,
that's very mind-blowing as well.
Can I tell you a common example that we see?
Yes, please.
Yeah. So, we defined chronic disease. I said substance use disorder is a chronic disease. Well, chronic disease is one of the criteria for chronic disease is the term chronic. Means it's not just here for a week.
Yes.
Another one is what we call relapsing remitting. Okay, that means it comes and goes. It can come and go. Okay. We see this all the time with treatments for diabetes and high blood pressure.
Yes, you're right.
Sometimes I'm doing well. Sometimes my blood pressure is under control. And then other times it's not. And so clinicians will make changes. For example, I might make recommendations to someone, say, hey, what do we think about sort of nutrition? What do we think about activity? What do we think about the medications that you're on? Could we make some changes? Okay. We call that relapsing remitting. Yes, up and down.
Gotcha.
Now, let's say I'm someone who uses heroin or another opioid.
Yes.
And I'm in a treatment program. Well, I have a chronic disease. It's going to relapse and remit. And when it relapses, AKA return to use, I might use heroin again. But what's going to happen when I go to my treatment program and I let them know?
Oh, you're getting kicked out.
I'm getting kicked out. Have you ever heard of someone getting kicked out from their primary care clinician's office?
Never.
Never. And it's something so common. How devastating. What a weird twist that we have when we think about treating folks with substance use disorder. These things to me are soul crushing, right? But maybe talking about it might empower some folks to say, that's not okay. And I'm going to let someone know that you kicked me out without justification.
Yes. Or even just the providers to say, you know what? Let's revamp this and let's do something that actually works, since when you do go to IOPs and certain type of programs, they always talk about how relapse is part of the process.
Yes.
So since we know that, right, can we please come up with a treatment plan that actually helps foster this?
Thank you. Yes, it's like the expectation is there instead of sort of being the exception.
Exactly. Catch-22, right?
Catch-22. Amani, something else that you mentioned is most people don't choose. And I'll tell you, guess what? Contrary to common belief, which is, I'm going to use a term that's not positive first-person language. You're an addict.
No,
okay?
You're right.
You're an addict because you chose to, and you're too weak to stop, and all those kinds of things. Well, how about we take a look at the last 20 years? Okay. Over the last 20 years, you've heard of this thing called the opioid epidemic.
Yes.
You've heard of maybe what we might call unscrupulous intention from a lot of major players and actors within healthcare, pharmaceutical companies, et cetera, et cetera. Well, a lot of it had to do with prescribing opioids. Okay.
Yes.
And long story short, we'll cut to the end, which is we find that over 80% of the folks who are now using heroin, which most recently has now become fentanyl.
Yes, you're right.
They started out with a legitimate opioid prescription.
Isn't that so sad?
Okay. So that wasn't someone who was experimenting. It wasn't someone who was looking to get high. It was someone who was following my
Doctor
treatment.
orders. Yes.
Sorry.
Yes.
Yeah.
Yes. And that's what we see a lot. That is exactly the story I hear a lot is I was prescribed this medication. Then I just couldn't get off of the medication. They kept upping my dosages and then wanting to take you off of the medication. I knew someone who was, following the doctor's plan, but just in such fear of, I don't want to get addicted to this. I don't want to get addicted. I'm like, well, you need to take your medicine. It's doctor prescribed. Take it as the doctor says only and share that with your doctor. I said, please share that with your doctor because maybe you could use for some maybe counseling or something else to help you.
Mm-hmm. Yeah, absolutely. Absolutely. Look, we've talked about a million things.
We
could
have.
keep going
We
on
really
and
could.
on.
This
was
was
supposed to be a
amazing.
little intro episode for our viewers and listeners.
They know what they're in
They
for
know
now.
what they're in for. Yeah, exactly. We could go on and on, but let's sort of wrap up per se. Yeah, let's wrap
love
up
it.
per
Let's
se.
wrap it up.
I think we've talked about some topics that might be coming up, but very free flowing. You know, a lot of this is basically most of it is unscripted.
Yes.
Aside from a few things that we're required to read for informational purposes and whatnot.
Most definitely.
And I am not smart enough to memorize, especially
I'm working on my
especially in my older age.
I have mommy brain.
So you might see me looking down to read things on a piece of paper every so often, but I do not want that to be the tone for these episodes. I'm hoping that is something that when the guest speakers, they can feel that, our viewers and listeners can feel, is that this is just off the cuff.
This
One
is us
professional
being,
to
yes,
another.
Yes, this is us being natural, literally keeping it real in this industry. I'm super excited. I'm super stoked to do this with you. I'm super excited for our guests too.
Yeah,
we got
absolutely.
some phenomenal guests coming in the future episodes.
Absolutely. Looking forward to working with you.
Same
Looking forward to our
here,
episodes.
most definitely.
And looking forward to hopefully have just this much impact. If we can even have this much impact, it's going to lead to significant impact for our communities.
It will. It will. Like you said, helping one, you never know, could help many.
Absolutely. So stay tuned.
Yes, please stay tuned, listeners. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or in Lyon County in Northern Nevada, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. Again, empoweredmoms.org. If you live outside of these areas, we really encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Roth, with production assistance by Rachel Mack. Writing assistance by Troy Stefano. Recorded at the Video Podcast Studio at Canico Media in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.